Do lower eyelids sag after surgery for under eye bags?
A common concern for people considering lower eyelid surgery for under eye bags is if the lower eyelids would sag afterwards. This is in part due to the conspicuous bug-eyed or sad-eyed appearance of some celebrities and politicians who my patients refer to during consultation. I'll discuss my approach to lower eyelid surgery to help people avoid lower eyelid sagging. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery, and I'm a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I routinely perform lower eyelid surgery for under eye bags in my practice using a technique called transconjunctival blepharoplasty. I tend to avoid making any external incisions in the lower eyelid skin, and I'm able to preserve the shape and character of your eyes. The results look natural, as if the eye bags were just never there. I also routinely perform cosmetic upper eyelid surgeries to treat hooded eyes and specialized procedures such as Asian double eyelid surgery and eyelid ptosis correction. As a cosmetic eyelid surgery specialist, I also perform revision eyelid surgeries to address complications of surgery performed by other surgeons. People with under eye bags often express a concern that if the volume of fat that causes eye bags were to be removed, that the eyelid skin would sag because the volume is no longer there to support the skin. They think in terms of the sagging skin that remains after someone loses a lot of weight. The lower eyelid anatomy is different from the anatomy of the abdomen. The muscles supporting the lower eyelid, called the orbicularis oculi muscle, is in front of the fat, as opposed to the abdomen where your abdominal muscles are behind the fat, which is located under the skin. This orbicularis oculi muscle acts like a belt, which tightens the lower eyelid after the fat is sculpted during surgery. There are other structures, such as the lateral canthal tendon, which may need to be addressed if there is laxity to prevent lower eyelid sagging from occurring. Rounded lower eyelids are referred to medically as lower eyelid retraction. Lower eyelid retraction is oftentimes seen when lower eyelid surgery is performed using an external incision called transcutaneous blepharoplasty. Unlike my preferred approach, transconjunctival blepharoplasty, where there's no incision on the eyelid skin, the transcutaneous blepharoplasty technique involves an incision on the lower eyelid just below the eyelashes. This approach to get to the fat pockets can potentially compromise the support of the eyelid skin, such as the orbicularis oculi muscle and the lateral canthal tendon, resulting in potential downward displacement of the lower eyelid. Well-intended surgeons will often remove skin in an effort to address skin wrinkling. Unfortunately, this can cause skin shortage, which contributes to the lower eyelid retraction. In my experience, in the lower eyelids, the skin wrinkling is more due to loss of collagen and a reduction in skin quality. Instead of removing skin to treat wrinkles, I prefer to treat the area to improve the appearance of wrinkles and crepey skin non-surgically with lasers, radiofrequency technology, and PRP. I routinely use lasers such as a fractional CO2 laser, fractional erbium laser, and long-pulsed erbium laser, which we refer to as smooth-eye laser. PRP, or platelet-rich plasma, is a concentration of the wound healing and growth factors found in the blood to help heal an injury, such as when you have a cut. All these tools helps stimulate collagen production, increase blood supply, and improve the outer skin texture. I perform the transconjunctival method of lower eyelid blepharoplasty using local anesthesia with light IV sedation, thereby avoiding the risks and complications associated with general anesthesia. My patients usually return to work in about a week after surgery. The take-home message is that fat reduction in the lower eyelids does not directly cause the skin to sag. The approach to surgery and the applications of lasers and PRP can make all the difference for your situation so you can look your best. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.